Swollen gums, medically known as gingival inflammation, is a common condition where the gum tissue around your teeth becomes inflamed, appearing puffy, red, and sometimes painful. Healthy gums should be firm, pale pink, and fit snugly around your teeth. When they become swollen, they tend to bulge, feel tender, and may bleed easily during brushing or flossing. This inflammation is your body's response to irritation or infection in the gum tissue. Think of your gums as the foundation for your teeth. They seal around each tooth, protecting the more delicate structures beneath. When this seal becomes compromised through inflammation, it creates a pathway for bacteria to potentially access deeper tissues. Swollen gums are often the first visible sign of developing gum disease, representing an early warning that something isn't right with your oral health. Causes of swollen gums. Swollen gums can result from a variety of causes, with some being temporary and others requiring long-term management. Number 1. Plaque buildup. The primary cause of swollen gums in most cases is the buildup of plaque, which is a sticky, colorless layer of bacteria that constantly forms on our teeth. When plaque isn't removed through regular brushing and flossing, the bacteria in it produce toxins that irritate the gum tissue, causing inflammation and swelling. This is known as gingivitis, which is the most common and mildest form of gum inflammation. If plaque remains on the teeth for more than a few days, it hardens into tartar, which creates a rough surface where even more bacteria can collect. Number 2. Hormonal fluctuations. Hormonal changes throughout life can significantly impact gum health. During puberty, pregnancy, menstruation, and menopause, fluctuating hormone levels can enhance blood flow to the gum tissues and change how the body responds to toxins produced by plaque. Many women notice their gums becoming more sensitive and prone to bleeding just before their monthly period or during pregnancy. Number 3. Medications. Various medications can contribute to gum problems either by directly affecting the gum tissue or by reducing saliva flow. Certain anti-seizure medications like phenytoin, cardiovascular drugs like nifedipine, and immunosuppressants such as cyclosporin can cause abnormal gum growth that appears as swelling. Additionally, medications that cause dry mouth create an environment where bacteria can thrive. Number 4. Infections. Infections are a significant cause of swollen gums. Bacterial infections, such as those caused by an untreated cavity or abscess, can lead to localized swelling and pain. Fungal infections, particularly oral thrush, can also cause red, swollen gums with white patches. Finally, viral infections, including herpes simplex and hand, foot, and mouth disease, can also contribute to gum inflammation and discomfort. Number 5. Nutritional deficiencies. Some nutritional deficiencies, particularly of vitamin C and vitamin B, can weaken the gum tissue and its ability to repair itself, making it more vulnerable to inflammation and infection. Even mild deficiencies can impact gum health and contribute to persistent swelling. Number 6. Dental procedures. Improper dental restorations or appliances can irritate gum tissue. Fillings or crowns with rough edges, poorly fitted dentures, or orthodontic appliances that rub against the gums create areas where plaque can accumulate more easily and where physical irritation damages the delicate gum tissue. Number 7. Smoking. Tobacco use severely impacts gum health by restricting blood flow to the gum tissue and reducing the delivery of nutrients and oxygen needed for maintenance and repair. The chemicals in tobacco products directly irritate the gum tissue, contributing to swelling and increasing the risk of developing more serious gum disease. Number 8. Underlying medical conditions. Some specific medical conditions can manifest with oral symptoms. Diabetes affects the body's ability to fight infections, making gum problems more likely and more severe. Autoimmune conditions like rheumatoid arthritis or lupus can also cause inflammation throughout the body, including the gums. Blood disorders like leukemia can sometimes present with swollen, bleeding gums as an early sign. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of swollen gums. The most noticeable sign of swollen gums is a change in their appearance. When swollen, they become red or purplish, puffy, or bulging, and may appear shiny due to being stretched. Pain and tenderness are common symptoms that vary from mild discomfort to significant pain that interferes with eating and speaking. The gums might feel sensitive when touched or when eating hot, cold, or spicy foods. Bleeding gums, especially during brushing and flossing, is another telltale sign of inflammation. You might notice pink-tinged toothpaste when you spit after brushing or see blood on your floss. Contrary to what some people believe, bleeding gums are never normal and always indicate some level of inflammation. Bad breath that persists despite brushing often accompanies swollen gums because the same bacteria causing the inflammation produce foul-smelling compounds. This halitosis can be persistent and difficult to mask with mints or mouthwash. Receding gums may develop as the condition progresses, where the gum line pulls back from the teeth, making them appear longer than normal. This recession exposes more of the tooth and sometimes even the root surface, which can lead to increased sensitivity. Treatment for swollen gums. The approach to treating swollen gums depends on the underlying cause, the severity, and how long you've been experiencing symptoms. Number 1. Improved oral hygiene. The foundation of treatment for most cases of swollen gums is establishing a thorough oral hygiene routine. This includes brushing at least twice daily with a soft bristled toothbrush using proper technique, gentle circular motions rather than aggressive scrubbing. Daily flossing is crucial for removing plaque between teeth where a toothbrush can't reach. Many dentists recommend using an antimicrobial mouthwash to reduce bacteria in the mouth. Number 2. Professional dental cleaning. When swollen gums are related to plaque and tartar buildup, a professional cleaning by a dental hygienist is necessary. This procedure, called scaling and root planing, involves carefully removing all plaque and tartar from the tooth surfaces, including below the gum line. Number 3. Medication. Various medications can help reduce gum inflammation and treat underlying infections. Prescription antimicrobial mouthwashes containing chlorhexidine can help control bacteria. Antibiotic treatments may be prescribed, either oral tablets for systemic infections or localized antibiotics placed directly into deep gum pockets. Anti-inflammatory medications might be recommended to reduce swelling and discomfort. Number 4. Surgical interventions. For advanced cases, surgical treatments might be necessary. An example of these is the flap surgery, which involves lifting back the gums to remove tartar deposits in deep pockets, then securing the gum tissue back in place. Home remedies for swollen gums. In addition to medical treatments, some home remedies can help soothe the swollen gums. Number 1. Warm compresses. Applying gentle heat to your swollen gums can work wonders for pain relief and reducing inflammation. Simply soak a clean washcloth in comfortably warm water, wring out the excess, and hold it against your face over the affected area for about 5 minutes. For added effectiveness, you can alternate between warm and cold compresses to really get blood flowing to the area. Number 2. Saltwater rinse. This classic remedy is popular for good reason. It works. Mix half a teaspoon of salt into a glass of warm water and swish it around your mouth for about 30 seconds before spitting it out. The salt helps reduce bacteria that cause inflammation while drawing out fluid from your swollen tissues. It's also great for loosening food particles stuck between your teeth that might be irritating your gums. Try this simple rinse 2 to 3 times daily, especially after meals, until you notice improvement. Number 3. Tea tree oil solution. Tea tree oil has powerful antimicrobial and anti-inflammatory properties that can significantly reduce gum swelling. To use it safely, never apply undiluted tea tree oil directly to your gums as it's too strong. Instead, add 2 to 3 drops to a small glass of water, mix well, and use it as a mouth rinse. Alternatively, you can add a drop to your toothpaste before brushing. Be careful not to swallow the solution, as tea tree oil is meant for topical use only. Use this remedy once or twice daily until your gums improve, but discontinue if you notice any irritation. Number 4. Turmeric paste. Turmeric contains curcumin, a compound with impressive anti-inflammatory and antioxidant properties. Make a paste by mixing a teaspoon of turmeric powder with enough water to create a consistency similar to toothpaste. Apply this directly to your swollen gums using a clean finger or cotton swab. Leave it on for 5 to 10 minutes, then rinse thoroughly with warm water. While this remedy is incredibly effective, be aware that turmeric will temporarily stain everything it touches yellow, including your toothbrush and possibly your teeth if used frequently. For best results, apply this paste twice daily until swelling subsides. At the end, living with swollen gums isn't something you should accept as normal. With proper diagnosis and treatment, most cases can be effectively managed or resolved completely. Now we want to hear from you. Have you ever dealt with swollen gums? What remedies or treatments worked best for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.